Hi to all. This lecture now is about the digestive system. The digestive system breaks down the food that we eat into nutrients. Specifically, the digestive system has four major functions. One is it ingests food. We take in food. Number two, it digests food, which means we break it down into nutrient molecules. Third, it absorbs the nutrients para makarating yung nutrients sa bloodstream. And lastly, defecation. It excretes the waste products to get rid of the indigestible wastes. So here are the organs of the alimentary canal. We have the mouth, pharynx, esophagus, stomach, small intestine, and large intestine. And then, there are also accessory digestive organs. The teeth, salivary glands, pancreas, liver, and gallbladder. First is the mouth. What are the important structures of the mouth? The lips protect the opening. The cheeks are on the wall, lateral side. Hard palate, soft palate, anterior and posterior roof. Uvula, it's a fleshy finger-like projection in the soft palate. Vestibule is the space between the lips and cheeks external and teeth and gums internal. Oral cavity proper is where the teeth is. The muscular tongue. It has two bony attachments, hyoid bone and styloid process of the skull. It occupies floor of mouth and contains papilla, important for taste sensation, the taste buds or the taste receptors. Lingual frenulum, it's a fold of mucous membrane securing tongue to the floor of the mouth. And yung lingual frenulum, nililimit niya yung movement ng tongue, especially the posterior movement. And lastly, tonsils, yung molt, they are at the posterior end of the oral cavity. When we now talk about digestive system, now again, the mouth is where food enters. It mixes with saliva. We masticate, which means we chew. In Tagalog, ninunguya. Ang minamasticate natin, nagiging bolus. And this is called mechanical digestion. And then, we swallow. Breakdown of food begins before it has even left the mouth. No? Kaya yung mechanical digestion, as we enter food in the mouth, mixes with saliva, we chew it into small bit-sized pieces, yun yung mechanical digestion. And recall also that the papilla of the tongue contains taste buds. They are in the tongue surface. So, besides food manipulating function, the tongue also allows us to enjoy and appreciate the food that we eat. So, ang ating mouth, no, may voluntary buccal phase, ninunguya natin, involuntary pharyngeal and esophageal phase, so automatic malulunok mo yung pagkain, no? Lalo na pag nandun na siya sa bandang posterior pharynx. Next, from the mouth, food bolus passes posteriorly to oropharynx and laryngopharynx, both of which are common passageways for food, fluid, and air. The walls of the pharynx contain two skeletal muscle layers. Inner layer longitudinal and outer layer is circular. So dapat ang dediretso lang pababa is yung food and fluid, no? Pero dapat, no, as we swallow, yung air, yun lang yung papasok dun sa isang area. Lalo na pag nakarating na siya ng laryngopharynx kasi nagsasara na yung epiglottis. Therefore, food and fluid na lang yung didiretso pababa. Alternating contractions of these two muscle layers propel food and we call that peristalsis. Ito yung movement ng food along the alimentary canal. It will now go to the pharynx down the esophagus. So, let's say for example, you eat a burger patty. So, yung burger patty na nginuya mo sa iyong bibig, naging bolus, dire-diretso yon through peristalsis, no? The layers, the muscle layers of the pharynx will now go down the alimentary canal. Didiretso siya ngayon ng esophagus. It's called gullet. It's about 25 centimeters long. It runs from the pharynx through the diaphragm down the stomach. It is essentially a passageway that conducts food, again by peristalsis, para makarating siya ng stomach. May nerve plexuses dyan. We have the submucosal nerve plexus and the mesenteric nerve plexus. These networks of nerve fibers are actually part of the autonomic nervous system. And what they do is they help regulate the mobility and secretory activity of the GI tract organs. The walls now of the alimentary canal from the esophagus actually hanggang large intestine. They are made up of the same 4 tissue layers or tunics. Here we see the mucosa, it's the innermost layer. Yung submucosa naman, it's a soft connective tissue. It contains the blood vessels, the nerve endings, meron diyang MALT or mucosa-associated lymphatic tissue, nandyan din ang lymphatic vessels. Next, yung muscularis externa, it contains the muscles, the smooth muscle cells. So very important for peristalsis or movement of structures or food or bolus inside kung esophagus pa lang siya. And we have the serosa, outermost layer. Ang inner half niya, visceral peritoneum. Yung other half, parietal peritoneum, which lines the abdominopelvic cavity. So, yung peritoneum, no, yan na yung nasa abdominopelvic cavity, outermost. Pag na-infect yan, we call it peritonitis. Next is the stomach. It's on the left side of the abdominal cavity. C-shaped ang stomach. It's nearly hidden by the liver and the diaphragm. It varies from 15 to 25 cm in length and can hold up to 4 liters of food. Kung walang laman ang stomach, it collapses inward and creates a large folds, we call it rejay. Now, sphincters are found all over the GI tract. When we say sphincters, kumbaga sa cardiovascular system, ito yung mga valves. They open and they close to allow entry and exit of substances. So in this case, pine-prevent din yung backflow, just like what the valves do. Here, yung upper stomach, nandyan ang cardio-esophageal sphincter. Nasa pagitan siya ng esophagus and stomach. Minsan tinatawag din siyang lower esophageal sphincter or cardiac sphincter. And then at the end of the stomach is the pyloric sphincter. Sa pyloric sphincter, yan naman ay nagko-connect ng stomach to the large intestine, particularly the duodenum, the first part of the small intestine. So, ang pumapasok sa cardiac sphincter, bolus. And iba na ang lalabas sa pyloric sphincter kasi na-digest na yung naipasok sa stomach. And we call that chyme, which we will further discuss later. There are several areas of the stomach. The cardiac region is just right after the esophagus. It's very near the heart, kaya tinawag siyang cardiac. Fundus is the most superior part of the stomach. The body, yan halos yung largest area ng stomach kung saan kayang magdala ng food or bolus. Antrum is the most inferior part, and pylorus is the end directly connected to the small intestine. What are the major functions of the stomach? First, it's a temporary storage tank of food. Yung nilunok mo na bolus, kaya niyang mag-store hanggang 4 liters. And second, it's the site for food breakdown from bolus to chyme. Chyme is a thick, like heavy cream substance. That's why I mentioned kanina, bolus enters the cardiac sphincter and chyme exits the pyloric sphincter. Ang ibig sabihin ng chyme, na-digest na siya. And we call this chemical digestion. Unlike what happened in the mouth, nagkaroon ng digestion kasi may saliva at may teeth. Pero dito, kaya chemical digestion kasi may mga gastric juices. But remember that chemical digestion starts in the stomach. Pero hanggang small intestine may chemical digestion din, which ends actually the chemical digestion. What are the gastric juices which starts chemical digestion? Intrinsic factor, needed for absorption of vitamin B12 or cyanocobalamin from the small intestines, hydrochloric acid, which is pepsin and renin. They are produced by pepsinogen and parietal cells. They make stomach contents acidic and they activate enzyme. So being an acidic environment, magkakaroon talaga ng chemical digestion. And lastly, gastrin. It's a local hormone for digestive activity of stomach also. Next is the small intestines. It's the body's major digestive organ as it finishes chemical digestion na nag-umpisa ng stomach. But after chemical digestion, magsa-start na yung absorption. Ibig sabihin lang nun, natapos na yung digestion, so yung nilunok mo na bolus, naging chyme na, as it finishes chemical digestion, na ilabas mo na yung nutrient nung kinain mo. Going back kanina, I mentioned that, for example, you ate a burger patty. So, nung ginuya mo siya, naging bolus yung burger patty. And then, napunta siya ng stomach, yung bolus naging chyme, kasi may mga acids doon. No? Pero kapag tinapos ng small intestines ang chemical digestion, inilabas mo yung nutrient mula dun sa burger patty, which is actually yung protein. So pag nandoon na yung protein, readily available na siya, pwede nang mag-start yung absorption. Meaning, dadalin mo na yung mismong protein, which is a nutrient, papuntang cells through the bloodstream. The small intestines is the longest section of the alimentary canal, 2.5 meters to 7 meters long. Imagine how long it is. It's also a muscular tube extending from the pyloric sphincter papuntang large intestine. So we have the 3 divisions: duodenum, 12-finger with long; jejunum is called the empty intestine; and the ileum is the twisted intestine. The hormones secretin and cholecystokinin, or the CCK, influence release of pancreatic enzymes and bile. Ang pancreatic enzymes nirelease ng pancreas, which actually finishes chemical digestion. Yung bile naman, it's important for fat emulsion. And then, nag-e-enter ngayon ito ng duodenum. So, amylase digests starch, trypsin digests protein, lipase digests fat. So, basically, ito yung mga pancreatic enzymes. That's why we are mentioning that yung protein kanina ng burger patty, readily available na. Kaya natapos na yung chemical digestion with the help of trypsin. Many other hormones aid in digestion. So, if you recall yung gastrin, intestinal gastrin, We have the somatostatin, histamine, meron ding mga gastric inhibitory peptide or GIP. On the surface of the small intestine, we see microvilli. They complete digestion of protein and carbohydrates. And when we talk about villi, dito ngayon nagaganap yung absorption. So pag sinabing absorption, dahil readily available na yung nutrient, no, whether it's carbohydrate, fat, proteins, vitamins, minerals, pwede na siyang ma-absorb papuntang blood vessel. And again, kailan nagaganap ang lahat ng exchange? Sa capillary level. So pag nakarating na ngayon ng blood, yung mga nutrient na ating na-digest, no, chemical digestion, makakarating na siya sa system. Circular folds are also found in the surface of the small intestine. The plicae circularis, it contains Peyer's patches. So, looking back, ito yung malt or lymphatic tissues which help sa immune function for the small intestines. The large intestines are about 1.5 meters long and extends from the ileocecal valve down to the anus. Ang ileocecal valve, siya naman ang nagko-connect ng small and large intestine. Ileo, kasi yung last portion ng small intestine is ileum, and cecal, because the first portion of the large intestine naman is the cecum. Two general functions. They dry out indigestible food by absorbing water as it finishes absorption. Kaya yung absorption, it begins in the small intestine and ends in the large intestine. And second, it now eliminates feces, no, these residues from the body. Ito yung process of defecation. Normally, we defecate on a daily basis as an end product or waste product of the digestive process of the GI tract. There are two kinds of movements in the large intestine. Yung haustral contractions, slow segmenting movements lasting about 1 minute that occur every 30 minutes and so. As a haustrum fills with food residue, this tension stimulates its muscles to contract which propels contents. So ito yung movement all throughout for peristaltic purposes. Mass movements, low, slow-moving but powerful contractile waves that move over large areas of colon 3 or 4 times daily and force contents toward rectum. Kaya nagkakaroon tayo nung nai-initiate ang defecation, yung urge to defecate. Here are the subdivisions of the large intestine: cecum, vermiform appendix, colon, and the rectum and anal canal. The cecum is the first sac-like portion of the large intestine, so yung kulay pink. It's connected to the small intestines via the ileocecal valve. The appendix is a worm-like structure hanging from the cecum. The appendix actually is a potential trouble spot kasi twisted siya. And dahil wala ditong peristalsis, no, maaaring magkaroon ng pagkaipon ng bacteria, it can accumulate and multiply. It's a condition called appendicitis. Actually, it's an emergency. Kasi dahil walang peristalsis dyan, tuloy-tuloy ang inflammation, baka ito mag-rupture. No? And kapag nagkaroon ng ruptured appendix, there could be internal bleeding and it's connected to the cecum, which is a part of the large intestine. That's why once there's appendicitis, no, kailangan talaga siya agad tanggalin. Appendectomy. Next, we have the colon. There are 4 subdivisions of the colon: ascending, up the right colic hepatic flexure, transverse, across the abdominal cavity, descending from left colic splenic flexure, and lastly sigmoid to enter the pelvis. Last is the rectum and anal canal. Together with the sigmoid colon, they lie in the pelvis, so malapit sila sa reproductive organs. Sa rectum and anal canal, wala ng villi. Again, para saan ang villi? For absorption, because you do not absorb anymore the structures in the rectum. Instead, nandiyan ang goblet cells. The goblet cells produce alkaline fluid, therefore, nag-act siyang lubricant para mas madaling mailabas ang feces. And the muscularis externa in the rectum and anal canal, they are reduced to tinea coli. Partially contracted, kaya nakapak yung walls ng rectum and anal canal. These muscles display a degree of muscle tone, especially kapag there's already an act of defecation. The sphincters are also there. Again, sphincters, they open and close during times of defecation. External anal sphincter is voluntary, while internal anal sphincter is involuntary. Moving on to the accessory digestive organs, we have the teeth. We masticate or chew by opening and closing our jaws, and we move them from side to side while continuously using our tongue and cheek muscles to keep the food between our teeth. It's a process again we call as mechanical digestion. It's the most important function of the teeth when we deal with the digestive function. Now, there are two sets of teeth: baby teeth, deciduous teeth, or milk teeth. Usually, nag-uumpisa itong mag-erupt at 6 months, and the first to appear are the lower central incisors. Ilan ang baby teeth? Usually 20, at complete na ito by 2 years old. The second set of teeth on the other half of the photo is the permanent or the adult teeth. Usually kasi ang baby teeth, by 6 to 12 years old, it starts to loosen or fall out. Kaya yung mga batang ganyan ng edad, nag-uumpisang mabungi. But by the end of the adolescent period, halos lahat ng permanent teeth nag-erupt na, except for the 3rd molars or the 4 wisdom teeth. Kaya usually by the end of adolescence, 28 na yung ipin nila. Ang wisdom tooth, right and left, up and down, usually erupts by 17 to 25 years old. Meron tayong 32 complete set of permanent teeth. Pero minsan, yung wisdom tooth, it may fail to erupt. Baka merong impacted wisdom tooth, or sometimes they are completely absent also. Another accessory digestive organs are the salivary glands, which produce saliva. There are 3 pairs of salivary glands which empty secretions into the mouth. The largest of them all is the parotid gland. They lie anterior to the ears. Now, ito yung beke pag na-infect or mumps. It's a common childhood disease. It's an inflammation of the parotid glands. Kaya if you look at the location of the parotid glands, you can readily understand na yung mga nagkakaroon ng beke, minsan, they complain it hurts too much when they open their mouth or chew. But the good thing is, meron na tayong vaccine against mumps. The other 2 are the submandibular and the sublingual glands. They are small glands and they empty their secretions into the floor of the mouth through the tiny ducts. Now, ano yung pinoproduce ng salivary glands? We have the saliva, na merong mucus and serous part. The mucus part moistens and helps bind food together para magkaroon ng bolus. Pero yung serous portion ng saliva, it contains salivary amylase, which can actually begin starch digestion. Other functions of saliva, they contain lysozymes and IgA or immunoglobulin. So immune function inhibit bacteria. And also, they help dissolve food chemicals so that they can be tasted. Recall also that production of saliva is controlled by autonomic nervous system. Our discussion in the nervous system. Parasympathetic or cholinergic nervous system, it stimulates saliva production. While sympathetic or adrenergic nervous system, it inhibits saliva production. The pancreas is a soft pink triangular gland across abdomen from spleen to duodenum. It lies posterior to the parietal peritoneum, kaya ang pinatawag sa location niya retroperitoneal. Only the pancreas produces enzymes that break down all categories of digestible foods. The earlier slides sa small intestine discussion, we mentioned amylase, which digests carbohydrates, trypsin, which digests protein, and lipase, which digests fats. These are the pancreatic enzymes needed for breakdown of foods. These enzymes are actually secreted into the duodenum. So, readily available siya sa small intestine. Kaya nga ang small intestine ang nag-e-end ng chemical digestion. Again, lumabas na yung protein from the burger patty that you ate. No? And then readily available for absorption. They actually are secreted in an alkaline fluid in the small intestine and na-neutralize yung acidic chyme from the stomach. So remember that the stomach is acidic, pero pag nasa small intestine na, alkaline na siya. Also, please recall that the pancreas has an endocrine function. Sa ating discussion ng endocrine system, the endocrine functions of the pancreas is when it produces insulin, glucagon, to name a few. These are hormones. So both endocrine and exocrine functions. Once the pancreas is inflamed, we call that pancreatitis. Next is the liver and the gallbladder. To simply explain it, the bile produced by the liver and stored by the gallbladder is important to emulsify fats. Sa lahat kasi ng nutrients, carbohydrates, fats, proteins, vitamins, minerals, fats ang pinakamahirap i-digest, and the bile helps emulsify them. Bile does not contain enzymes, but its bile salts emulsify fats by physically breaking large fat globules into smaller ones. Kaya nagpo-provide siya ng more surface area for the fat digesting enzymes from the pancreas to work on, which is lipase. Now, si liver na nag-produce ng bile, it has many critical metabolic and regulatory roles. However, ito nga yung kanyang digestive function, production of bile. Bile actually leaves the liver through the common hepatic duct. And then, mag-enter siya ng duodenum through the bile duct. Si gallbladder naman, it's a small, thin-walled green sac in the inferior surface of the liver. When food digestion is not occurring, yung bile, it backs up the cystic duct and enters the gallbladder to be stored. Nakatago lang siya doon. While in the gallbladder, bile is actually concentrated kapag nagre-remove tayo ng water. When fatty food enters the duodenum, a hormonal stimulus prompts now the gallbladder to contract. Tapos, ilalabas niya ngayon yung bile. Kaya available na rin siya sa duodenum. As the bile pigment circulate through the body, no? Ibig sabihin, nakalabas siya. Dapat nandoon lang siya sa GI tract. Specifically in the small intestine. Doon lang dapat normal na may bile. The small intestine, but as it circulates through the body, the tissues may become yellow. Bile is green, pero pag napunta sa labas ng katawan other than the small intestine and these structures, tissues become yellow. Yun yung jaundice. Kaya nagkakaroon tayo ng jaundice or yellow skin. Madalas ito ay result kasi baka may actual liver problem, such as hepatitis, which is infection of the liver. May mga virus, no, na ito yung cause. But only hepatitis B yung may vaccine pa. No? Cirrhosis means nagkaroon ng liver damage. Usually, yung mga nagdidrink ng too much alcohol for several years. And now, if bile is stored in the gallbladder for too long or too much, no? Tapos nawala, no, yung tubig, no? Water is too much water is removed. The cholesterol it contains may crystallize. Kaya nagkakaroon ng gallstones and it requires usually surgery. Here now is a summative illustration of the gastrointestinal physiology. The major functions of the digestive tract usually are summarized in ingestion, digestion, absorption, defecation. No? Pero may mga specific activities pa kasi na hindi na-cover ng mga terms na yon. And again, no, the essential activities of the GI tract would include nilunok mo siya as ingestion, mechanical breakdown when you chew, and then nag-propel pababa, you swallowed them via peristalsis. Nag-start na yan through the esophagus, and then you digest. Ibig sabihin, inilalabas mo na yung mga nutrients from the foods that you eat. Digestion begins in the stomach and ends in the small intestine. We are talking here about chemical digestion kasi sa stomach may acids. Sa small intestine, alkaline siya pero nandiyan ang pancreatic enzymes and bile. And then sa small intestine, no, so nagkaroon na tayo ng chyme na dating bolus. The nutrients are there, therefore absorption is ready. Nandyan kasi ang mga villi. And then, going down the large intestine, absorption will end there, especially absorption ng water and other minerals. And lastly, as a waste product of this metabolic activity, magkakaroon ng defecation, feces, no, exit of the waste products of digestion. Just to recall the essential nutrients, we have the carbohydrates. Glucose is the primary source of heat. So it provides us energy. The fats are our concentrated source of heat. It also provides us energy. Proteins, also for energy, also important for growth and development. We have several vitamins, fat-soluble vitamins, water-soluble vitamins, no, usually denoted with letters. Vitamin A, vitamin B, B1 to B12, vitamin C, vitamin D, vitamin E, vitamin K. Please recall their names and also the different minerals, sodium, potassium, calcium, and the like. Now, how do we assess the abdomen? Remember that I have mentioned previously that the technique in assessing is IPPA. inspect, palpate, percuss, auscultate. But exception is the abdomen. When we are talking about the abdomen, the correct sequence is IAPP. We inspect first, we auscultate next, palpate, then percuss. What's the reason? Bakit yung A naging second step? When we are assessing the abdomen, auscultation should be done prior to palpation and percussion. Why? Because palpating and percussing the abdomen will alter the bowel sounds. It's important to assess the abdomen. Majority of abdominal contents are actually the digestive organs. So it can help determine problems associated with the GI tract. What to inspect? When we inspect, we consider the 4 quadrants and the 9 regions. So please recall them again. Check for skin. Are there dilated veins? Are they striae or stretch marks? Meron bang scars? May rashes pa or may lesions? Next is the umbilicus. Normally, the umbilicus is sunken. Nagbabulge ang umbilicus sa mga buntis, lalo na pag nasa last trimester of pregnancy or yung may mga hernia or umbilical hernia. What about configuration? Is the abdomen flat, globular, protuberant, or on either sides, is it symmetrical or asymmetrical? Next is auscultation as the second step. Bowel sounds should be heard. Bowel sounds are actually made by the movement of the intestines as they push food through. The intestines are hollow, so bowel sounds echo through the abdomen, much like the sound heard sa mga water pipes. Paano ang sequence when we hear bowel sounds? So making use of a stethoscope, sequence best is right lower quadrant, then right upper quadrant, then left upper quadrant, then last is left lower quadrant. Ano dapat ang maririnig sa bowel sounds? So normal sounds, hindi dapat hyperactive, hindi hypoactive. Ang naririnig na normal para siyang clicks or gurgles. Ideally, how many? It ranges 5 to 35 sounds per minute. Next is palpation, kakapain. Light, dahan-dahan, deep, didiinan, lalo na kung gustong ipalpate yung internal organs. When you palpate, usually, light, isang kamay. Pag deep, pwedeng isang kamay na diniinan, or pwede ring 2 kamay. Check for muscle guarding, para bang naninigas. May direct tenderness ba? Meaning, nung kinapa mo, nasaktan siya. Or, pag rebound tenderness naman, nung kinakapa mo, walang naramdaman. Pero nung tinanggal mo yung kamay mo, doon niya naramdaman yung masakit. Organomegaly, after deep palpation, naramdaman mo yung organs beneath, tapos na-assess mo, they are big, large, Lumalaki yung mga internal organs, which is usually abnormal. Wala dapat organomegaly. And lastly, masses. So, meron ka bang nakakapa na mga bukol? Well, these assessment findings are just superficial. But of course, if you really want to check, may organomegaly ba? May bukol ba talaga sa loob? Syempre, kailangan natin ng mga further tests. And those are tests that help visualize internal organs using machines such as X-ray, CT scan, MRI. Lastly is percussion. So, ganun ulit, may pinupukpok ka. Non-dominant hand, ilalagay sa abdomen. Dominant hand, you tap, and then tap. Usually sa middle finger, the space between distal and proximal interphalangeal joint. The anterior gas-filled abdomen normally has a tympanitic sound. Ito ay long, high-pitch, and loud sound. Unlike, as mentioned before, sa chest, ang sound ng percussion sa intercostal spaces ay resonant. Pero ang sound ng percussion sa abdomen, tympanitic. If the sound you hear when you percuss the abdomen is dull, ibig sabihin baka may solid viscera, fluid, or stool. If the flanks naman are duller, mas dull, baka may posterior solid structures, and usually yung right upper quadrant mas dull pa siya kasi nandyan ang liver. That's the end of the digestive system discussion. Thank you very much.